I have Dr. Lee, who is from National University of Singapore, and he's an interventional cardiologist there. He presented one trial yesterday, so we would like to ask him about his trial. So tell me something about your trial. What did you present yesterday?
Thank you very much for the questions. So yesterday we presented the CRESCENT trial for the very first time. The background is that we know hypertension is a major cause of cardiac and cerebrovascular diseases, and optimal blood pressure control is really of paramount importance. At the same time, we know that obstructive sleep apnea is a highly prevalent condition. In fact, moderate to severe obstructive sleep apnea affects more than 400 million people in the world. And this condition has been known to be underdiagnosed, but at the same time, a modifiable risk factor for hypertension. Conventionally, we know CPAP is the first-line treatment for obstructive sleep apnea. Unfortunately, despite its being effectiveness, I pause for a while first. Despite its being effective, the CPAP have problem that a lot of patients either refuse to use the CPAP or they struggle with the adherence, and therefore clearly alternative is needed. For that, we are interested in a dental device called mandibular advancement device. Mandibular advancement device is actually an oral appliance therapy that reduces the airway collapsibility by advancing the mandible forward by a few millimeters during sleep. And it has been shown to be effective to improve the symptom of OSA, but what we did not know earlier is that whether it's effective in reducing blood pressure. That's why we conducted the CRESCENT trial, which compared the relative effectiveness of mandibular advancement device versus CPAP in reducing blood pressure.
Thank you very much for this answer. I have another question for you. Do you think the mandibular extension devices are as good as CPAP machine? What's your experience about that?
It has been shown that, in fact, both the mandibular advancement device and CPAP are both able to improve the symptom of OSA. So what we did not know is whether they are also comparable in terms of improving blood pressure. And that's why we conducted a trial. And our trial was designed as a non-inferiority trial. And in the end, we find that mandibular advancement device is non-inferior to CPAP in terms of improving blood pressure in patients with OSA, hypertension, and also increased cardiovascular risk.
Thank you, Dr. Lee, for your comments. To watch more videos like this, please check out youtube.com, FITsOnTheGo, and follow us on Twitter, @ FITsOnTheGo. Thank you.